Your employer's health plan could be the reason you are having frustration at your pharmacy. The health plan is likely working with a pharmacy benefits manager or PBM to provide your prescription coverage.
There are hidden prices and deals. Your health plan and pharmacy benefits team are like middlemen who deal with drug companies, pharmacies, and insurance companies. They negotiate how much drugs cost, but often they don't share all the details of these deals. This means that the actual price they pay for a drug might be much lower than what they say it is, thanks to secret discounts or rebates.
Someone else is deciding which drugs you can get, and it may not be your doctor. Your health plan and pharmacy benefits team make lists called formularies that decide which drugs your insurance will pay for. But how they decide which drugs go on this list isn't always clear. Sometimes it's more about money than which medicine works best for you. Charging more than they pay. Sometimes the health plans charge pharmacies more for a drug than what they actually pay for it, keeping the difference as profit. This practice, called spread pricing, isn't openly shared.
The fees and extra charges. The health plans charge fees for managing drug benefits, but these fees can be confusing and hidden, making the whole system more complicated.
There are undisclosed contracts. The health plan and PBMs and manufacturers have contracts that say they can't tell anyone about the deals they make, which keeps everything behind closed doors. Here's what we know. There are higher costs. Because of all these hidden deals, you might end up paying more for your medicine than you should. The price you see might not be the real price after all the discounts are applied, but you don't get to benefit from those discounts.
There are limited choices. Without clear information, you might only have access to certain medications, not necessarily the best ones for your health, just the ones that make money for the PBM or insurance company.
There are surprises in pricing. The cost of your medicine can change without warning because you don't know how prices are really set or what deals are being made behind the scenes. Less information. You and your doctor might not have all the information needed to choose the best treatment because the full picture of drug costs and benefits is obscured.
There are trust issues. When you can't see how decisions about your medication are made, it might make you feel like the system cares more about profit than your health, which can be frustrating and make you less trusting of healthcare providers.
There is limited ability to choose. If you don't know the real cost or the details of the deals, you can't argue for cheaper medication or better coverage because you're not fully aware of what's possible.
In short, when the employer's pharmacy benefits manager aren't working in the employee's best interest, it can lead to higher drug costs, fewer choices for patients, and a general feeling that the healthcare system isn't working in your best interest.
Thank you for your attention. You might want to talk to your employer's human resources department if you're having a lot of frustration at your pharmacy.